thank you so much, especially to Denny, for letting me come and just share the awesome story of how God has worked through me and others to be able to provide healthcare to those that are uninsured. So I wanted to start by taking a little show of hands. Does anyone here know someone that does not have health insurance? So there's like a hand up everywhere. And then a little more personal, has anyone ever not had health insurance at some point in their life? There's a lot of us. Unfortunately, in the United States, our health care is associated with our job. So if you are not Native American or a veteran or have Medicare, you don't have access to health care, which is a major, major problem. Luckily, I'm Cherokee, so I've always had Indian health to fall back on. But there was multiple times in my life where I did not have commercial insurance, and if I didn't have a tribal facility close by, then I was paying out of pocket. And I had experience with my young son one time that got hurt, and we were at a period where we didn't have insurance. And my first thought was, he needs to be seen by the doctor. How much is this going to cost? Like, you're thinking about all these things that should be the last thing you're thinking about, but you're not, because it can impact your life and your finances. So I just wanted to share kind of how God has used me to show off and be awesome, because God is so good, and how He has blessed me with certain skills that are able to bless others and makes my job so awesome, because I get to love on people and just tell others how awesome God is. So I kind of wanted to start at the beginning and then just walk you guys kind of through this journey, and then ultimately just give God the glory for being so awesome and for everything that He does. So preparing for this speech, it really got me to think back from the very beginning on how I got on this journey to becoming a physician. Some people always know what they want to do when they're little, but I didn't know that I wanted to be a doctor until I got to college. I always knew I wanted to do something that helped people, but I didn't know that it was going to be in medicine. So through a series of lots of doors that the Lord opened, I met people and really just fell in love with science and how I could always learn something that was very complex and always changing, but also have relationships with people and be able to make a difference in their lives through medicine. So the combination of both of those went hand in hand. Go ahead, next slide. One of my favorite verses is Psalms 139:14, which says, "I will praise you because you are fearfully and wonderfully made. I know your works are wonderful, and I just praise you." And I think the Lord just showed me that He's so awesome, like how He made the world, but like our bodies and how complex they are and how everything has to work together just perfectly to function normally is amazing. And through that journey, through science and getting into medical school, like there are books after books after books of all the things that go wrong and then how we try to fix them. So when you see the miracle of life or that your blood pressure functions, like all these things, we just take it for granted that the body that the Lord has given us like just works, and we don't really think about it until it stops working for us, and then we have a problem. So through medicine, I was able to fulfill a joy of always learning and being able to help people in times of need. But I was able to see that medicine is much more than just science and bodies. It's the whole person. And through residency, I was able to see that pills don't fix everything. There are lots of other issues that need to be addressed to really provide quality health. So my first job out of residency, I was a primary care physician, so I knew I didn't want to specialize like cardiology or pulmonology, because I wanted to do a little bit of everything. So I loved having a relationship with people, and I actually could get to know them, they could get to know me, and I feel like you have a better opportunity to provide healthcare to someone that knows you and trusts you than meeting like a complete stranger. So I was really able to walk with people and get to know them, and just realize that their high blood pressure or uncontrolled diabetes was so much more about access to healthy food. Do you have shelter? Do you have a loving, supportive family? And a lot of people didn't have those things, and I could tell that by their laundry list of medications, how often they came to the doctor, their no-shows. All those things play a role. So to be a really good healthcare provider, I need to address the whole person. And that's really hard to do in 15 minutes when you have lots of them, and with how medicine is, there's a lot of barriers to providing good care because we're kind of on a clock. But as I went through Indian Health, I met Denny, who was a wonderful social worker. We know how awesome Denny is. But she really helped me try to improve some of the challenges. They couldn't always be fixed, but we could try to make life a little easier. And we have a billion stories, but I would try not to cry in the room until I get out, and then I'm just broken because I know this person, their life is so hard. And the Lord just uses us, though, in little bits of time to try to bring a little bit of joy to people when they need it. And that's how God is. He just shows up all the time and uses relationships in certain periods in time to connect with other people. And I think my patients really felt the presence of the Lord, which was more than you're asking for sometimes when you just go to the doctor. So after leaving Indian Health, I have 4 children, so my life is very busy, and I needed to change my schedule so I could be home more with my children. And I moved to urgent care in West Tulsa, and it was different in that I wasn't primary care anymore, so I didn't always have a relationship with my patients, and I just saw people that walked in the door. But it gave me an opportunity to share God's love to a lot more people that I would not meet on a regular basis. And through being at urgent care, I would see the self-pay people, because everybody has the paper that says your insurance, and there would be self-pay. And at my job, it's $99 to come see the doctor, which is a lot of money. And when you hardly got, you had difficulty getting to the doctor, $100 is a lot of money. And sometimes they were there for a cough and cold, and my heart hurt because you just paid $100 for me to tell you that you have a cold. Or on the other hand, you have high blood pressure and 17 problems, but I know I can't just fix you or give you medicine, then you can't afford it, and there's no follow-up. So I had a burden on my heart that I need to help these people. I wanted to be able to say, this is what I can do for you today, but come to this place. They can see you, provide health care, and try to help you get on a better road. But that didn't exist in the western side of Tulsa. We have lots of safety net clinics in Tulsa, but there are barriers to get there. If you don't have transportation or money to drive to Tulsa, all those free services are not going to help you. So, next slide. I thought about trying to start a nonprofit. The Lord put on my heart that I think you need to start a free clinic. If anyone started a nonprofit, it's a really big deal. I didn't realize how many hoops there are to jump through. And I needed help. So 2 of my friends that I went to school with, we were talking about how do we start a free clinic. And my friend Zach said, why don't you reach out to TJ? He started a nonprofit called Cura for the World. He probably can help you start just trying to get through some of these hoops. So I had not seen TJ since medical school, which was 10 years ago. I sent him a little message on Facebook Messenger because I didn't even have his phone number. And I said, hey, I'm thinking about starting a free clinic. I know you started a nonprofit. Would you be interested in showing me some tips on how to do this? And he sent back an immediate response and said, oh my goodness, I've been waiting for somebody to reach out and tell me that they want to start a clinic in the United States of America. So it was a God moment that he had aligned our visions, and it was in his perfect timing. So I did not have to create a nonprofit. I just came in under the umbrella of Cura for the World, which already had 4 free clinics in third world countries at that time. And his goal was to have one in the United States because we have lots of people here that need free health care just like we do in other countries. So we partnered together, and I was able just to start a clinic without having to do all the other stuff. And starting from that moment forward, that was in October of 18, the Lord just showed up. So whenever he calls us to do something, he just provides, and it's amazing, because you know that it's nothing we can do. It's definitely from the Lord. And it just happened. So by July of that year, our clinic was open. Next slide. This is our favorite little corner at a restaurant in Sand Springs where we have all of our work meetings. But TJ's on the right, Sam is a PA that also had a heart for serving others, and then Zach is on the left. And this was the team that just made it happen. So the Lord provided friends that were like-minded, and between all of us, we created this clinic. God was so awesome. He provided people at the right time, and we were donated a free space to house our clinic, so we didn't have to pay for rent. And then a physician retired. A physician retired and gave us all of his medical supplies and his table and his pictures on the wall, like everything. And then the people just came to us because we're a strictly volunteer-run clinic. So I had people that we've never met before say, I just want to get involved, I want to give back. So it was definitely in the Lord's timing because we could not have done all that. It just fell into place. So we opened our doors in July of 2019, and we had a line out the door and around the corner of people that were waiting to get access. And since that time, we were in like a 700 square foot little building with 2 exam rooms. You can go to the next slide. And then the Lord continued to bless us, and through just lots of little who knows who, we ended up having a 4,000 square foot building. Now we have 4 exam rooms and a lab. So I guess my advice is to, when the Lord tells you to do something, you just got to do it. Yeah. You don't always have the how and the when and all of that, but if He wants us to do something, He's going to provide for us. And He, like Tim, you said, His ideas are so much bigger than our own, and we have a plan, but His plan is just bigger, and it is bigger and better than anything we could imagine. You go to the next slide. So, like, my mother-in-law is right here. This is Trisha. She volunteers at the front desk and welcomes patients. And next slide. These are some of our regular providers that they work full-time jobs, but they're there every week seeing patients, and it's just amazing. So, I encourage you to seek your purpose. If you haven't found your purpose yet, you ask the Lord what that is in your life and just help Him to make it clear so that you can do the works that He wants you to do while you're on this earth, and not be scared, because He's going to ask you to do big things if you really do ask that prayer. But know that He will show up and He will make it happen, and it just falls into place, and that you know that it's definitely in the Lord's timing, and that's what you want to be done. So with healthcare, we have so many opportunities available for people. So part of my passion is letting people know, how do I help others access free healthcare. Part of it's networking, just like through who you know, like Denny's able to help point a lot of people in the right direction. But 211 is a service that you can call. We've had a lot of patients come to us from 211, so they're able to tell a lot about what opportunities are available based on where you live. Also, it's word of mouth, so we have patients that come see us and then tell their friends, and other people come. And we also try to get out in the community and just let people know that our services are available, and to let people come our way. And also, if you just do like a Google search and you say free clinics, it'll pull up all the safety net clinics that are available in Tulsa. Our Cura is really awesome because we partner with multiple agencies, so we're able to provide x-rays and labs and specialist visits, all of that stuff for free. So we've had a lot of really awesome patient stories where someone had like severe osteoarthritis of their hip and could not work, and we were able to get them a hip replacement, and they were back in the community. We've had multiple cases of cancer where if you have no insurance, that is a bad place to be, and able to get them the help that they need, and Some of them have been cured, which are blessings. And then we've had some that haven't, but we walked with them through the end of life, and the Lord has just shown up there and provided free hospice for one guy, and like it's just, he's there. So our job is just to be there, and then the Lord makes things happen. But we're able to make a difference in our patients' lives, and that's what is such a joy with medicine, because I'm able to meet a person at a special place in their life, which oftentimes is not a good place. They don't feel well, they're unhealthy, mentally unwell, and we're just able to show them God's love and let them know that He loves you and that it's going to be okay. So I encourage you to find your purpose, and if your purpose is helping others or healthcare, there's lots of places to volunteer that you're able to give up your time and your service and just love on people and show them